All right, I think we can go ahead and get started, and folks can continue to trickle in as we're doing this introduction part. Welcome, everyone. Thank you for joining me this afternoon. Really excited to present to you today on preventing poisoning during COVID. This has been a topic that we have presented a lot over the last 9 months, and poisonings just keep on happening. So, even though we're this far into the pandemic, there are still a lot of risks that we are seeing folks encounter and a lot of exposures that are still happening. So I'm joined today by my colleague, Alex. He's going to be helping moderate, and then I'm going to give him a section partway through to talk about some of our new data. So this is Alex, everyone. My name is Megan, and we are both public health education and communication specialists at the Washington Poison Center. Oh, I just have a comment here that they can't hear me. Can everyone else hear me all right?
Yes.
Yes. Okay, great. Hopefully we can troubleshoot for you there and make sure that, okay. Yeah, thank you, Alex. So as we're getting started, I am going to launch a quick poll just to get a sense of who all is here and what you are interested in. Alex, feel free to be working on that troubleshooting. I can launch this first poll. So I'm curious to see what all you are interested in learning about today. Cleaning safety, some of our data trends, adolescent substance use, or just really any safety tips to stay healthy and safe. Give folks another few seconds to fill that out. We got about 50%. Another couple seconds, then I'm going to close it down. Great, and I'll share that out so you all can see it. So it seems like most of you are just really interested to learn any safety tips to stay healthy and safe, followed by some of our exposure data trends. We will definitely cover some of those today. I have some graphs that are included in the slides, and then I've also uploaded a few of our data snapshots that you all can download into the materials. Alrighty. So here is our agenda for the day. I'm going to start with just a brief overview of the Washington Poison Center, and then we are going to dive into COVID poison prevention. We will talk about cleaners and sanitizers, some of the main exposures that we're hearing about, and then some easy prevention tips to make sure those exposures don't happen. We'll talk a little bit about nicotine and cannabis and the new data that we just released this morning. And then we will round out with a section on medications, followed by adolescent self-harm, which has a lot to do with medications. A little bit of housekeeping before we dive in. I have force muted all of you, so you aren't going to be able to unmute yourself. If you have any questions, please pop them in the chat box. You can send them to myself, to Alex, to everyone, whatever you feel most comfortable with. We'll be checking that chat box a lot to make sure that we cover any questions that come up. I am recording this webinar today, and I will send it in a follow-up email to all of you. So you will also see on your control panel on the side of your screen that there is a material section. I've uploaded a bunch of different things in there, including the slides for today, some of those data trend reports I will be talking about, as well as some medication resources that we will be going through. All right, let's get started with the Washington Poison Center. So I want to get us all on the same page first on what I mean when I say the word poison. For us at the Washington Poison Center, we take an extremely broad definition of what a poison can be. It can be really anything, any product, any substance, because anything can be harmful if it's used the wrong way by the wrong person or in the wrong amount. So that applies to what you would traditionally think of as a poison, like bleach and chemicals, but it can also apply to a lot of different other things, like your standard household products. That might be craft supplies, cosmetics, personal care products, flowers, plants, berries, fumes, vapors, snake bites, insect bites and stings, medications, drugs, alcohol. Really, the list is endless. And to broaden it out even more, those poisons can be harmful to someone through a lot of different ways. If they're inhaled, if they're ingested, if they get in your eyes, on your skin, something that might be safe to ingest might not be safe to get in your eyes. There are all sorts of different ways that something can be considered a poison, even if it is typically safe to use. So the Washington Poison Center is one of 55 poison centers in the United States. We have been here in Washington for over 60 years, providing folks with expert treatment advice and education about poisons, drugs, drug overdoses, all of those things that we just covered. So we have Alex and I who provide education across the state. We also have another individual in Eastern Washington who has the same job as us. And then we have really our bread and butter service of the Poison Center, which is the telephone helpline. That is this phone number here. It is a national toll-free telephone number. That means you can call us from anywhere in the United States and you are going to be directed to your local poison center. We are always open 24/7 every day of the year, even during the COVID-19 pandemic. Our hours have not changed. You can call us at 2 a.m. or 2 p.m. and someone will be there ready to help you. We are also always free. We never ask for insurance information. We're never going to send you a bill. And we are also totally confidential. A lot of people, parents, worry about us reporting them if their child has had a couple exposures within a certain time period. We never report. We are always going to be confidential. And if English is not your primary language or your preferred language, we have access to interpretation in over 260 languages. So I'm going to be sharing a lot of data today, but most of that data is going to be looking at very small segments of calls to the Poison Center. So I wanted to share this number with you all just to give you a general sense of just how many calls, how many patients we are managing every year. So last year in 2019, we handled more than 125,000 calls regarding more than 66,000 cases. So cases are patients. You'll see that there is a difference in number there between patients and calls because a lot of times a single patient is going to involve multiple calls. They might have had a complex exposure that involves lots of different steps to help treat them. Or a lot of times we also just like to call those patients back to make sure that they're doing all right and to see if they have any other questions. Those calls to us are coming from a lot of different places, primarily from the home, workplace, or school. But we also receive calls from people who, from medics and EMTs who are either on the scene of an accident or are en route to an emergency room. They might be calling to see if potentially that person can stay home. They don't need to go to the ER, or they might be calling to get a jump start on that treatment for someone who's had an exposure. We also receive a significant number of calls from healthcare providers. This is new news for a lot of people who don't realize that physicians will call us in emergency rooms and other healthcare facilities when they need assistance treating some of those more complex cases. So about a quarter of our calls are from doctors and other healthcare providers. Now, unsurprisingly, about half of our calls are about kids that are younger than 6. As you all well know, being in the Safe Kids world or working with youth serving organizations, kids explore the world with their mouths. They love to get into things that they shouldn't, and they are constantly putting things into their mouths that they should not be putting in their mouths. So very unsurprising that so many of our calls are about little kids. But we do receive calls about people who are teens, adults, and older adults. And those calls actually tend to be more serious than those pediatric exposures. That could be because there were multiple things that were taken. It could be greater amounts were taken or just more serious substances in general. All right, I'll check the chat box really quick. I don't think we've had any questions here. And I just realized I totally blew through my introduction of Fran. I am so sorry, Fran. So this webinar is being held in partnership with the Safe Kids Coalition. Fran helped me organize this, and she She sent out the webinar through her listserv, which reached all of you. So really grateful to Fran and Safe Kids for their partnership with this and helping get the word out. All right, so we're going to dive now into poisoning during COVID-19. So I gave you that definition of a poison, and it is obviously very broad. There are lots of different things included in there. So how in the world do we categorize all of those different exposures to all of those different substances? Typically, we have these call categories. When someone calls us, whatever their exposure is going to fit within one of these buckets. We have unintentional exposures. Those are accidental. There are adverse reactions to drugs or food, and then there are the intentional exposures. Now, we are concerned with all of those different categories, obviously, but during COVID-19, we really focus in on these 5 that are highlighted in orange, because we are seeing pretty big increases in exposures in all of these areas. Now, why is that? The number one reason is that we're home all the time now, a lot more than we used to be, and that has really forced us to establish some new daily routines. It has increased our access to a lot of different potentially harmful substances. We might be purchasing more of those harmful substances like cleaning products to make sure that we're keeping up with COVID transmission prevention. And it's a very stressful time. We have a pandemic going on. We had an election. We had all sorts of other things happen in 2020 that has just made this year ridiculously stressful. And all that stress can lead to a lot less focus when we are cleaning, when we're taking our medications, when we're doing any of those daily normal tasks that might involve some potentially harmful substances. There's also a lot of rumors and misinformation floating around out there, and that can lead people to have poison exposures if they think that doing a certain thing, using a certain substance might help them prevent COVID, when in reality it might lead to a very unfortunate, harmful experience. We are very much seeing increases in calls to the Poison Center. We're seeing spikes in substances that are common to COVID prevention, like hand sanitizer, household cleaners, bleach, and rubbing alcohol. We'll talk a little bit more about this in the next section. We're also seeing spikes in exposures in particular demographics. So specifically adolescents in their intentional use of substances. We'll talk a lot more about that towards the end of the presentation. And then older adults, so adults 60 and up. We are not alone in these trends. This is happening all across the United States. Our data, our trends are really paralleling other poison center trends. All right, so now we're going to start going through all of those different substances, what the risks are, and how to prevent exposures to them. And we're going to start with some household chemicals. So this is a very broad category. It can include a lot of different substances like cleaners, disinfectants, detergents, soaps, pesticides, fertilizers. Very, very broad. And it has really always been a top substance that we receive calls about. They're really common. Most people have them in their homes. It's a very common kind of exposure or substance to be exposed to. But during this outbreak, we're seeing even more calls about household chemicals. And that's for a lot of different reasons. People might be using certain products more, like cleaners and disinfectants. They might have more of those products in their home right now. They're distracted with what's going on, especially if they have kids at home or if they're juggling all these multiple responsibilities. There's fear of the virus, which may be causing them to use substances in ways that they shouldn't be used. Lots of different reasons that we've already covered already. The issue with these cleaning substances is that they're really important for preventing the spread of the virus, but they can be very harmful if they're used incorrectly or in the wrong amount. So I have another poll, which I'm going to have Alex launch. So one of the top substances within this category that we're hearing about is bleach. So Alex, if you could launch that poll, I want you all to guess, what's the most common reason for bleach exposures that we're hearing about? What are people doing? I'll have you select one, give people a little bit longer. Give folks another couple seconds. All right, Alex, I'll have you close the poll and share that out. Excellent. Yes, most of you guessed misuse, so not using a product in the way that it is supposed to be used. And you are definitely right in that. So this is the first of the data I'm going to share with you from some of our data snapshots we've been releasing throughout the year. In these snapshots, we compared a set number of days in 2019 to that same number of days in 2020. So this is from January 1st to like mid-June of each year. And it's looking at bleach exposure reasons on the left-hand side. The orange bars are from 2019 and the blue bars are from 2020. So you'll see in that misuse category, there has been a 62% increase in bleach misuse exposures. So that means that people are using bleach in their homes, and they might not be following those directions like they should be. They might be using bleach in ways that they should not be using bleach, that it's not intended to be used. For example, they might be spraying a bleach solution on their masks or on their clothing, and then that's causing them to inhale it, inhale fumes, or it's getting on their skin and they're having some sort of skin reaction. They might be using wipes that contain bleach inappropriately, wiping down the wrong things, or lots of different things that could fall into this category. Potentially, they needed to dilute a bleach solution, and they chose to make that solution stronger than what the instructions said. They intentionally misused it, and that led to having some sort of harmful reaction, some sort of exposure to the substance. So the graph on the left looks specifically at bleach. The graph on the right looks at just household cleaners, bleach, and rubbing alcohol in general, all of those cleaning substances combined. And there has been a large increase across the board of misuse of any of those cleaners. So how do you, prevent these types of cleaning exposures? Some of these are going to sound like no-brainers, but they're very important to follow, and they're so simple to follow because really it's the easiest way to prevent any sort of harm from happening. So wear gloves, open windows and doors to ensure adequate ventilation, because fumes from cleaning products can definitely cause some harmful reactions, can cause coughing, irritation to the throat, the nose, the eyes, can cause trouble breathing. Lots of different things can happen. Then read and follow all directions and safety warnings closely. Labels contain a lot of very excellent poison prevention information. So it's really important to actually read those labels and understand how the product should be used. One thing that we have heard a lot about this year is that it's less common now than it was earlier in the pandemic, but there was a big shortage of cleaning products in stores. And so people were purchasing products that they weren't necessarily familiar with. Different brands, different ingredients, just different products than what they were used to. But they weren't following the instructions that were specific to that product. They were using this new product the way that they've used previous products, and that led them to have some sort of mistake with them, some sort of accident and harmful reaction. Specifically with concentrated products, be sure to follow those directions on dilution, because more concentrated does not necessarily mean that it's better or more effective. If anything, it will just put you at increased risk of having a poison exposure. And then only use products as they are intended. Look at that label. What does it say you can use it for? Be sure to stick with just that, not using it for other things like food or on your skin. Then we always recommend to never mix cleaning products. When you mix cleaning products, these different hazardous gases can be produced, which can cause a lot of bad symptoms like coughing. It can cause some people to pass out. It can cause a lot of throat and eye irritation. some trouble breathing. It can be pretty serious depending on the amount of gas that is produced and how much a person breathes in. So never mix cleaning products. Be sure to check product ingredients to make sure that if you're cleaning back to back, you're not mixing anything. Bleach is one of the biggest culprits with these mix-up mistakes. It's not always listed as bleach on a label though, so it's important to understand what other names are for those ingredients. Bleach could be called sodium hypochlorite instead. If you're ever unsure about what is safe to do with your cleaning products, you can call us at the Poison Center. We have talked to our pharmacists and nurses that work in our call center, and they prefer to talk to people who are just calling to ask questions, because hopefully that means that they are preventing a poison exposure later on. Then there is no need to use cleaning products on food. That is something we've heard about a lot of people trying to sanitize their takeout or their groceries. But when you do that, you run the risk of mixing those chemicals into the food products. So there's also no evidence currently that COVID is transmitted via food. So all you need to do is to just wash your hands after you get back from the grocery store, after you get back from picking up takeout. Wash your hands before you eat. If you have any produce, just wash that produce with water like you normally would instead of soaking it in some sort of cleaning solution. For masks, we're receiving calls about people who have sprayed or soaked their masks in bleach and other cleaning products to sanitize them. And when they're doing that, when they put those masks back up to their face, they are getting that chemical on their skin, which is causing some skin reactions, and they're also inhaling those fumes from the cleaning chemicals. So just wash your masks with soap and water. You can throw them in the washing machine. You can throw them in the dryer to sanitize them some more, but there's no need to spray or soak them with cleaning products or disinfectants. Some final tips here are to always store products in their original containers. You can see the Gatorade bottle and the Lysol bottle there. If you had Lysol in that Gatorade container, they look exactly the same. You'd never be able to tell the difference. So always keep those products in their original containers and then label those containers with something that is very quickly identifiable. We at the Poison Center have Mr. Yuck, which is this green sticker who's making a yucky face, and it has our phone number on it. You can always request stickers from us for free on our website. We're happy to send them, but you can use other forms of labeling too. You can color the caps. You can put pieces of tape on there or other stickers. And then always store products up high and out of reach of young children. Here's our phone number. Again, you're going to see this a lot throughout this presentation, but just remember, you can always give us a call if you have any questions about what is safe to do or if you have some sort of accident while cleaning. I wanted to talk a little bit about hand sanitizer as well. So in order to be effective, hand sanitizer has to have a high alcohol content, usually about 60% alcohol. So this is a lot stronger than any wine, beer, and most hard liquors that are available. And it can pose a pretty significant risk to kids who might be curious and decide that they want to take a sip of something. So this has always been an issue. We get calls all the time from kids who have gotten into like those little backpack hand sanitizers that just like clip onto the outside of your backpack, or the fun flavored and fun smelling, or not flavored, the fun smelling hand sanitizers that are very intriguing and appealing to those kids. But obviously, since we are using hand sanitizer a lot more often now, this is just increased risk for any kiddos who might be around that sanitizer. And sure enough, we have seen an increase this year. So the orange bars are kids who are between the ages of 0 and 12. And there has been a 41% increase of hand sanitizer exposures by those kids. So I mentioned that could be from hand sanitizers that are just readily available, like clipped onto backpacks or purses. Might be hand sanitizers that are just left out on the counter that a kid gets into. But then we're also seeing these mix-ups, these really look-alike hand sanitizer products that are pretty concerning and are most likely going to, if they have not already, led to some hand sanitizer exposures. So on the far upper left, we have a bottle that says it's edible, which hand sanitizer is definitely not edible, so that's concerning. Right next to it, there is a hand sanitizer bottle that has a squirt cap on it, like a water bottle. And then below, there's hand sanitizer that has a dosing cup with it. Why you would ever need a dosing cup with hand sanitizer, who knows? And then on the far right, we have packets of hand sanitizer that look a lot like those little pureed fruit or vegetable packets that kids eat a lot. So when you have hand sanitizer around kids, make sure that you are supervising them when they are using the hand sanitizer. You should apply it to their hands. Don't let them apply it themselves. Use a just small amount, dime-sized amount, and have them rub their hands together until they're dry. That way they won't lick their hands, get it into their eyes, or anything like that. Keep those bottles out of sight and out of reach when they are not in use. Don't just leave them out on the counter. And then give us a call immediately if a child is exposed to hand sanitizer. Don't wait for any symptoms to arise. Just be safe and call us right away. There is one last thing with hand sanitizer to share with you all. This was really big news a couple months ago, that there is an FDA product list that contains a couple hundred hand sanitizers now that are all being recalled. So some of them are contaminated with methanol, which is a different form of alcohol that is actually quite toxic. Typically wouldn't cause any toxicity or bad symptoms if it's just used on the skin, but it can be very harmful if it is ingested. So if a kid were to get into it. This list also now includes some sub-potent hand sanitizers. So those are hand sanitizers that don't actually have enough alcohol in them to actually work, to be effective. So there is essentially not a lot of point in using them if they're not going to kill germs like you want them to. You can always give our Poison Helpline a call if you have a hand sanitizer that's on this list, if you're worried about exposure to that, or if you just have questions about your hand sanitizers. Alrighty, I'm going to turn it over to Alex now. I will check the chat box really quick. So what are the symptoms of hand sanitizer exposures, I'm assuming? So it would be symptoms of alcohol poisoning, essentially. So that could be someone, well, if it is a kid, they could be acting like they are intoxicated to start out. They could be lethargic, a lot of kind of depressant type symptoms happening. So if you're worried at all, even if you're not sure if a kid has gotten into hand sanitizer, just give us a call right away and we can walk you through everything. Okay, I'm going to turn it over to Alex now. We released some new data this morning on nicotine and cannabis, so he is going to share that all with you.
All right, can folks hear me okay? All right, very good. Okay, next slide. There we go, perfect. So we're going to start with nicotine. For those who've been following Poison Center data for some time now, we typically will send out what we call snapshots over a specific exposure for that year. We've done things a little differently this year. So generally what you're going to see is going to compare the first 9 months of 2019 to the first 9 months of 2020. Because we're not done with 2020 yet. That gives us a similar benchmark to compare. So if you are familiar with our nicotine exposure data, you might be used, or you might know of this trend that by and large, exposures in little kids have actually been decreasing over the past couple of years. Now, there are a ton of potential reasons as to why. It could be folks are way better at storage. It could be that other larger policies on marketing, advertising, packaging, and all that may be a factor as well. So many possibilities here. But right now, the big takeaway, or a big takeaway from this, is that most of our exposures with nicotine are with little kids, 0 to 5. And like Megan said, that makes sense. Kids explore everything. It's very stressful for the guardians and adults in their lives. It doesn't mean we don't get exposures in other age groups. They just they're just not nearly as common. Next slide, next graph. Oh, I forgot there's a little animated bit there. And so most of this, I should say, most little kid exposures, again, this makes a lot of sense, are ingestion. Regardless of the tobacco product itself or the nicotine product itself, it's most likely, if a little kid gets into it, it's most likely going to be an ingestion. Put it in their mouth and swallow it. All right, so this shows the types of nicotine products just for 2020. This isn't looking at 2019. And again, most exposures are for little kids, 0 to 5 years of age. Most of these exposures are for raw tobacco, actually. So that could be a cigarette. Kid puts a whole cigarette in their mouth. That could be loose leaf tobacco. That could be chew. There are so many things that could count under that kind of raw tobacco category. And at first glance, this may make you think, oh, well, that's where we should totally be concerned about. We don't need to worry about the other types of nicotine exposure. And that's not the takeaway we want to send with it, the message we want to send with this. So it's not that we're not concerned when little kids get into raw tobacco. We certainly are. Generally, though, they're going to be much smaller doses. The ones we tend to be more concerned about that are more clinically worrisome are the electronic cigarette or vapor product exposures, especially the liquid. The e-juice, e-liquid as it sometimes is called, because it absorbs super quickly. It's not just, if it gets into the mouth, it's not just going through the digestive process like most ingestion does. It also absorbs through the membranes in the mouth, and that can bring on symptoms very, very rapidly. And that can be pretty scary, actually. So, as always, if there's ever any even suspected exposure to nicotine, just call the Poison Center, and they'll walk you through what to do. It is worth noting that about a third of all of our e-cigarette or vape exposures involved flavored liquids. And again, that makes sense. Most of these exposures are little kids. Flavored products smell sweet and reportedly taste sweet. So there's that kind of extra incentive in that sense there. Next slide. Okay, so we're now talking about cannabis. Specifically, we're talking about THC. So THC, or the fancy name, is delta-9 tetrahydrocannabinol. That is the main component to cannabis that brings on intoxication, or it's the main psychoactive component. It's called a cannabinoid. That's just kind of a broad term for these. So THC-specific exposures, this is kind of not very surprising looking at past data. The trend continues where we are seeing an increase in data rather than a decrease. So this is different than nicotine. And again, we can't say that there's a specific single reason as to why. We have been tracking THC exposures for some time, and we have noticed kind of a gradual increase, especially since legalization. And we, you can kind of see that this is across the board as far as age goes, but generally we see exposures in either little kids, and again, that's very similar to nicotine in that it's ingestion. So it could be a product that's just sitting out that a kid eats. With adults ages 21 to 59, though, these tend to be from different reasons. So can you go to the next slide? So this is looking just at the 2020 data, not the 2019 data. By and large, again, these little kids, these are what we call unintentional or accidental exposures. So an edible is left out that's out of its package, and the kid just pops it thinking it's candy. For adults, though, generally it's going to be what we call intentional abuse, and that generally just means that the individual was seeking intoxication. They were trying to get high. In a lot of these cases, they ended up having more than they meant to, or it affected them in a way they didn't expect. You'll also notice this misuse category. It's kind of a broad category, but that essentially just means inappropriate use. So they used a given product incorrectly. All right, next slide. I believe this, correct me if I'm wrong, Megan, but I think this is the last cannabis one. Now, this looks at the types of cannabis products. That's what we mean by formulation. So nearly half of all of our THC exposures or cannabis exposures involved edibles. About a quarter was for plant material. And then we have about 15% for concentrates. And this last kind of elusive other category, this refers to sort of the rest of the products. Is there more and more product coming out all the time? So this could be pills, capsules, topicals, and various things like that. All right, final point here. It is worth noting most exposures with kids that that involve THC involve an unsecured product, so a product that wasn't stored safely. They were left out of sight of the child. They weren't locked up. Kid knew where it was, and they got into it. And so this is a big part of why we advocate safe storage for everything, medication, substance, cleaner. And folks may not be familiar with this logo here, this Not for Kids logo. This is legally required in the state of Washington to be on all packages that contain, all edible packages that contain THC. And this has the Poison Center number there. So this could be part of why we get more calls for edibles than other types of cannabis products, because folks think it's written right there. Folks might make that connection more readily. Oh, I should call the Poison Center with this. They may not think about that in the moment if it's an exposure to plant material or a concentrate.
Perfect. Thank you, Alex. So if people have any questions about those snapshots, please throw them in the chat box. I know we went through that really quickly. We also didn't really cover much information about nicotine and cannabis, period, about what the potential harms could be. So we're happy to dive more into that. I did upload these snapshots so you can look a little bit more at some additional data and additional call out boxes. They're in that materials section on the right-hand side of your screen. So nicotine and cannabis, there's a lot of concern for good reason around them and a lot of hype around them, especially now during COVID with all of these increased concerns about substance use. But we really at the Poison Center like to emphasize to people that cannabis and nicotine aren't the only common household substances that can be an issue. And they're, if anything, they're not as common of an issue as some of these other more common household products like medications. So we're going to talk a little bit about medications. This is obviously a big category because there can be prescription medications, over-the-counter medications. We throw vitamins and supplements within here as well. And so they've always been a top concern for us at the Poison Center. We've always received tons of calls about them, especially with older adults, because they tend to be taking more medications and have a lot more physical and cognitive age-related things happening to them that put them at greater risk of having some sort of mistake with medications. So during COVID-19, though, we get even more worried about medication-related errors because we're having these new daily routines, which might have removed any sort of memory cue that we previously relied on for medications. So for example, if you have a child who needs to take a specific medication every morning before they go to school, if you used to always give it to them as you were walking out the door to take them to the bus stop or whatever you were doing, you might not have that same memory cue now that the child is at home doing school through Zoom. So that memory cue is now gone, which might lead to making a medication mistake, like double dosing on accident or skipping a dose even. There's also, as I've mentioned multiple times throughout this presentation, a lot of stress and distractions currently that can lead to any of these errors, like taking the wrong dose, taking it twice, or even just taking a little bit more than you should, taking the wrong medication entirely, just totally mixing them up, taking the wrong person's medication, taking a medication at the wrong time, or taking a medication the wrong way. A good example of this is folks who might have toothpaste in their medicine cabinet as well as hydrocortisone cream or something like that, and they put the cream on their toothbrush instead of toothpaste. So the first few tips I'm going to go through are more related to if you or your child is regularly taking a medication, like a prescription, a vitamin or supplement, or some over-the-counter med like an allergy medication. A good way to prevent medication errors with these regular medications regularly taken medications is to use some sort of physical tracking system. Now, this can take a lot of different shapes and forms. There can be medication checklists. So I actually uploaded one into the materials that looks just like this. You would write down the name and then you check it off after you have taken the dose. Or you could use a regular wall calendar, a phone calendar, any sort of physical way to check that off. There are also lots of cell phone applications that provide reminders to take your medications, that have a checklist. They'll even give prescription refill reminders, lots of different things that they can do for you. The one that is listed here on the slide is MediSafe. It's free. It's very well reviewed. And then there are also pill organizers. This is a tough one for us to recommend at the Poison Center, though, because pill organizers are not even remotely close to being childproof. They are very easy for a kid to get into. And we receive lots of calls of children who have gotten into a pill box and have taken the medications within there. So if a pill organizer is being used, a pill box, then be sure to keep that out of sight and out of reach of the kid, or even potentially locked up. And we'll talk a little bit more about safe storage in a bit. Again, with some of those regularly taken medications, it can be really important to use a medication list. This makes sure that you really have a firm understanding of what exactly is being taken and how to take it. And it also helps you check to make sure that you aren't going to have any interactions with other medications. So a good medication list will include all medications, prescription and over-the-counter, vitamins, supplements, and any other substances that are regularly used. We like to remind folks that if you regularly use a substance like cannabis, then that needs to be included in this medication list as well. For each substance, include the name, dose, why you take it or why the child takes it, the time of day to take it, and any special instructions, like if it needs to be taken with a glass of water, with or without food, or to avoid certain foods. Now, what about those medications that you might not be taking very regularly, or if you're giving a child a medication for a cold or something like that? Be sure to read medication labels very closely. It's just like with those cleaning products. Labels are going to include a lot of important, essential information to make sure that you are staying safe while using that medication. So be sure to check the dosage and what's recommended and at what recommended time increments. See if there is a cap on how much you can take within a 24-hour time period. Check the ingredients as well to make sure that you aren't double dosing with any other medications. Acetaminophen is a big culprit with this double dose scenario. So acetaminophen is Tylenol, which is in a lot of different substances, a lot of different medications. So, for example, if your kiddo has a cold, you might give them a cough and cold preparation that has acetaminophen in it as a fever reducer. But then they're also complaining that their head hurts, so you might give them some children's Tylenol as well. Well, that is also acetaminophen, so you could have inadvertently double dosed with acetaminophen. There are also some good safe dosing recommendations here. Always for liquid medications, use the dosing cup that's provided with that medication or a dosing syringe, never a common kitchen spoon. You want to make sure that you are giving the correct dose, and a kitchen spoon can really range a lot in size. So be sure to use whatever actual measurement tool you have that came with the medication or a syringe that you have on hand. Double check the amount. We hear about this a lot as well. Perhaps you mix up where that decimal point is and you end up giving the wrong dose, or you mix up what the unit of measurement is for that liquid medication or for the tablet. So be sure that you're really reading that label and checking how much to give. And then finally, always call medication what it is. Medicine, not candy. When you call medication candy, it can entice kiddos that have a sweet tooth to maybe get into those vitamins or supplements, get into that medication that tastes so good, and that can be very harmful to them if they get into the wrong thing. Our final tip here with medication is safe medication storage. So you always want to keep medications in containers, either their original containers or in a pill box that you are keeping in a safe spot. If you are using a pill box, be sure to keep those original containers on hand so you have that label available to check all of the important information you need to know. Store these medications out of sight and out of reach of kids. Another reminder that child resistant does not mean that it is child proof. Even those prescription pill bottles that have the child resistant caps on them, those are not actually child proof. If given enough time and if they are determined enough, a kid can definitely open those bottles and get into the child resistant containers. So always keep those medications out of sight and out of reach of them. And preferably use a medication lockbox if possible. So we'll talk a little bit about medication lockboxes in a little bit. If it's a concern for you on being sure that you are still able to take your medications when you use a lockbox, because it takes extra time to get into a lockbox, so it can be a barrier for some people, then keep out just 7 days worth or a small amount of that medication so you don't need to get into it every day. And then don't hang on to meds. Get rid of any expired, unneeded, or unwanted medications in your household. When you keep those medications, you run the risk of taking the wrong medication, taking the wrong dose potentially, and a number of other sorts of medication errors. Thankfully, in Washington, we have a very robust medication return system. We live in one of the best states for this. We have this website, takebackyourmeds.org, which is listed there in red. We at the Washington Poison Center run it, and it lists in either a map function or a list function all of the different secure medicine return disposal sites in our state. So most of these are located in pharmacies. So that could be a grocery store pharmacy or like a Walgreens or a doctor's office pharmacy. Sometimes they're in sheriff or police departments as well. They're always free. You can just put your medications in a bag and throw them in that disposal box. No one will access those medications. They're just taken out of that box and incinerated. Oops, sorry about that. I see I have a couple questions here. Let me check really quick. Do you have all this information or flyers in Spanish? Unfortunately, no, we don't have this presentation or these materials in Spanish yet. We are working, though, on getting some of our more general poison prevention materials translated. So I'm hoping that we will have that sometime in the next few months or so. And it looks like there was another question about that on Spanish. Yep, same thing. So hopefully, stay tuned. Hopefully soon we will have some more information in Spanish. We do, if any of you are interested in lead poisoning, though, we have a lot of materials on lead poisoning prevention that are translated into 8 languages. Correct me if I'm wrong, Alex. Those are available on our website as well. And another question here. Do the disposal boxes take back inhalers? I was told that you cannot include them because the canister is under pressure. Oh, that is a great question. I don't actually know the answer to that for the boxes. I believe usually if you look at the Take Back Your Meds website, it'll list if there are any substances that a specific box won't take. If you have questions, though, specifically about the inhaler, maybe call that location to see if they know. Yeah, I know for the mailback envelopes, you are not, the inhaler envelopes are different, they're separate. So in King County, this isn't the case in all of the counties in the state, but here in King County, we definitely have mailback as well. You can go to this website, I'll put it in the chat box, medproject.org, and you can request a mailback envelope. So this is a really good option, especially now during the pandemic, if you don't want to go out and make a separate trip to return medications. So you can request a medication mailback envelope for prescriptions. You cannot return vitamins or supplements through mailback, though. And then if you need to return an inhaler or an injectable medication, those are separate envelopes to request. So perhaps if you live in King County, who asked that? Susan, then maybe you should just request the envelope for the inhaler, because they will for sure take those inhalers back that way. What about expired EpiPens? Same thing, I would maybe request the envelope for the injectable thing. So that'll be on that Med Project website. Does the Washington Poison Control have a Spanish line? So it's the same poison helpline. If you can call it, and then there is interpretation available in over 260 languages. So Spanish is obviously one of those. So you'll be prompted when you call the poison helpline. And you can also ask the pharmacist that you're connected with or nurse that you're connected with that you need to use the language line. Okay, I think I got all of the questions here. So in these last 8 minutes, I'm going to probably pretty quickly go through this adolescent data. So I included this in here, and it's right after the medication section, because this is one of our primary concerns at the Washington Poison Center with teens. Medication use, intentional medication use among teens is very concerning, and it has been something that we have been following for quite a while. So this is some historical data that shows that since 2014, cases about children and adolescents who are intentionally using a substance to harm themselves or under suspected suicide, that's been increasing over the years. And when the pandemic started, there was a lot of concern, and continues to be concern, that self-harm and suicide might increase over time, especially among adolescents, as they are encountering so much stress. They're not having access to the same support systems that they previously had. They're around some of these substances a lot more. So there's been a lot of concern that this pandemic is going to lead to increased substance use, increased self-harm, increased suicide among this age group. So in end of July, we looked at data for the first 6 months of the year, comparing 2019 to 2020. So again, those orange bars are 2019 and the blue bars are 2020. And this is looking specifically at intentional cases in adolescents, ages 13 to 17. So self-harm and suicidal intent cases have increased 5% this year. And then abuse cases, so that's using something with the intent of becoming intoxicated, wanting to get high, those cases in adolescents have increased 34%. So the intentional self-harm and suicidal intent cases, that's not a huge increase, but obviously any case of self-harm or suicidal intent in a young person is extremely concerning, and it needs to be addressed and prevented. A little bit of a closer look into those self-harm and suicidal intent cases. This is looking at gender in 2020 as well as 2019, and it's primarily females, young women who are taking these substances intentionally for self-harm or suspected suicide. And there are a lot of potential different reasons why this is the case, which I really don't have time to go into today, but it's quite interesting to look into the self-poisoning in women research. It's starting to become a bit more common to look at. This is what I really want to draw attention to. So these are the top substances that were used by adolescents in these self-poisoning, self-harm, and abuse cases. So the top two boxes are the self-harm cases, and the bottom ones are abuse cases. There's a lot of different substances that are listed in there, but what I want you to see are where these red arrows are. Ibuprofen, acetaminophen, antihistamines, this always trips me up. Dextromethorphan. Those are all very common household medications. And a lot of times they're household medications that are available in bulk in large quantities. And so that is a huge concern that these kids, these teens are using substances that are very readily available to them. Now, how can you prevent adolescent exposures? Safe storage and disposal are essential. We highly recommend using lock boxes for medications. There are a lot of different kinds of lock boxes. They differ in their features and their durability. We don't have any specific brand that we recommend. What we do say, though, is you want something that is durable, preferably with a combination lock, not a key, and then preferably not with an external facing latch, because those are very easy to break and then open. And here's that Take Back Your Meds website one more time. Get rid of those leftover medications you have in there, especially if you have any more high alert medications like antidepressants, antipsychotics, opioids, anything that could really be harmful if it's taken by the wrong person. There are some great resources that are available in Washington for helping talk to kids about substance use. These are hyperlinked in the slide deck so you can access them later. And one thing we want you all to do is to remind kids about the Good Samaritan law in Washington. A lot of people don't realize we have this, but the Good Samaritan law is wonderful. It means that if a teen is in a situation where one of their friends or they themselves have gotten into trouble with a substance, with alcohol, with cannabis, with opioids, with anything, they are legally protected in Washington. They can call for help and they are not going to get in trouble. The whole point of this is to make sure that people stay healthy and safe if they are in an overdose situation or in some sort of harmful situation. They're not going to get in trouble. They just need to get the help that they need. Here are some more self-harm resources. Again, these are hyperlinked. The National Suicide Prevention Lifeline. Please call 911 though for immediate help after self-harm. 1 minute to go. I just want to make sure y'all understand what the process is like to call us. Please call us anytime you have an emergency or anytime you have a question about what could be safe to do. You will talk with one of our expert nurses or pharmacists that work in our call center. They're going to guide you through a series of questions on what happened, how long ago did it happen, how much was taken, how are you or that other person feeling. If you don't know all the answers, that's totally fine. They just want to get the best sense of what's going on. They will then tell you what to do. Most of the time, we can treat you at home. That's preferable, especially now during COVID. But if you do need to go to the emergency room, we'll tell you that. We'll tell you if you can drive yourself or if you need to call an ambulance. And we're going to tell you everything you need to do, symptoms to watch out for, etc. And then oftentimes we're going to call you back later just to make sure everything is all right. Our phone number, that last time there, please give us a call anytime you need help. 2:30 on the dot. So here is both of our contact information if you have any questions. Thank you all for joining us today. I realize it's 2:30, so if you need to leave, feel free to hop off. I'll follow up in a couple days with the recording of this and all of the resources that we went through today. Alex and I can stick around for a few minutes, though, if people still have questions. Looks like there's one here. How often does the poison line receive carbon monoxide poisoning calls? That's a great question. I don't know how many calls the Washington Poison Center gets. I know nationwide, though, it's in the thousands per year. They get a lot of calls about carbon monoxide poisoning. And I didn't include that in today's presentation. So thanks for bringing that up. Our recommendations with carbon monoxide are to make sure you have detectors in your main living areas and outside of bedrooms. Check them every year. A good time to remember when to check them is around daylight savings time. And yeah, you can always call us with any concerns about carbon monoxide or questions about it. Will this be emailed to us? Yes, we will. I will email this to everyone. Any other questions? Feel free to pop them in the chat box or email either Alex or I at any point.
And to clarify, even though our phone numbers are here, when we say call us, we mean call the helpline. We'd just be like, we'll transfer you. If you want to schedule a webinar or something, feel free.
Yes, please feel free to share the slide deck, our resources with anyone. Happy to get that information out to folks. And if any of you work for organizations or community groups that might want this presentation or other presentations Alex and I give, please feel free to reach out. Our education's always free. We're super flexible. We love doing stuff. Alrighty, folks, I think there probably aren't any more questions. So please, if you do think up anything, send us an email. Otherwise, thank you all for joining the presentation today. It was a pleasure. Have a great rest of your day and happy holidays.